many patients death without respiration. What is this? This end, after the horizontal incision, enter to the trachea. This place fixated to the skin with the sutures, and this plain plastic plate on the external surface, and this patient breathing from this tube, tracheal tube. Very easy. And this saw, C-A-W. This flat saw with change blade, and this, and with change this saw flat, this arch, this form as arch, saw, and this flat saw. This used from the amputation on the one part, the middle side of the humerus and the radius and ulna. Very easy. The name this instrument, this spoon. This used for the clear from the oval abscess in the skin, derma and hypoderma. This is very easy. This instrument has name foot and abdominal retractor. Very correct, abdominal retractor by Liston. And how you use? I fixated in the easy place where produce incision in the abdominal cavity, and I fixated, this. You have anesthesia, you narcosis, and this hop, and this fixated liver produce operations enough organs, the small intestine, the duodenum. Thanks for you, and return in the reanimation room. No, continuous.
You do surgery for you, not for us.
This is forceps for the bones, cutting for the bones. Take this bone.
Take your finger bones.
No. This for the tube bones. For example, these ribs and the metacarpal, metatarsal bones. And how we cut the first rib? The first rib, these forceps for the cutting first rib. How we find? The first rib lies horizontal, and you see all perhaps on this. This end remove to the first rib and cutting the costal cartilage, and remove the first rib and see, have you lunch, have you don't have. That for the increase the ribs, retractor for the ribs, I don't find on this. That, and this instrument we use for the cutting the little bones, for example, this distal phalanges, and trepan with change place. Where one part? No, this don't find. And this superior part, inferior part. You find on this place, on the bones, and I show for you. And perhaps on the X-rays after trauma, you find the bleeding as the dura mater in venous sinus. And for your task, remove the blood. You produce, this opens on the skull, or produce window and see, you have brain. And remove blood from this place. And perhaps from this window you made the little, this is change. And I don't find the change diameter, this is biggest diameter. Where you find the little diameter, you produce 1 point, 1 point, 2 point, 3 and 4. Between this point, you cut in, perhaps with scalpel, and this close the white window on the skull with trepan. Так, this is old instruments. This is don't used on the 21st century. This is old. This increase the diameter. This is close. Don't used. This is old instrument. And these forceps for the bones. One bones, two bones. This is bigger. This is small bones. These forceps for the bones. And you see simple ends on this instrument. After who produce on this instrument material from French country. And perhaps a little canule. Show for me. And this is a little canule or needle for the thoracic cavity of this needle, you see? And where you find the air in the chest, this is pneumothorax. You produce a little incision and from this window remove air from the chest. And don't have very difficult problem because this is needle and diameter near the 2 millimeters.